Hello, and thank you so much for the opportunity to speak to you this morning about the power of physical activity. This is a topic which I feel incredibly passionate about, and I hope that by the end of this 30-minute session that you have perhaps learned something new about physical activity and why it's so important for men with prostate cancer, and perhaps can be considered a hidden superpower which we can help them to achieve. So over 10 years ago now, back in 2011, Kenfield and colleagues were perhaps some of the first to really start to demonstrate that men who were vigorously physically active at sort of three or more sessions of vigorous intensity physical activity per week had up to a 61% lower risk of prostate cancer death compared to men who are less active. So we started to have some science around physical activity in prostate cancer over a decade ago, but clinical practice perhaps has been slow to catch up. And I don't know about your clinical practice and where you work, but it would be interesting to see how many people feel that conversations around physical activity and physical activity support are truly embedded into cancer care. This is what I'm hoping to cover over the next 30 minutes. So we'll do a bit of setting the scene. We'll talk about why this is so important. We'll have a quick sort of think about prostate cancer treatment and its impact on being active. I'm sure I don't need to dwell too much on that. If you sort of think about the men that you see day in, day out in your clinics and think about why what we do to them by way of prostate cancer treatment is likely to impact on their physical activity levels, I suspect that will be a fairly easy one to answer. I will take you through some of the evidence related to each of the treatment types for prostate cancer. And there are references either throughout the slides or on a reference page on the back for more detail if you want to read up on those studies. And then we'll turn our attention to what can we do about it. I'm fully aware that in many treating centres for prostate cancer, we don't necessarily have access to specialist physiotherapists, to specialist exercise physiologists, to exercise instructors with experience in cancer. I'm hoping that if we were to sort of, add on another decade, that statement would be untrue. But we need to be realistic as to the expertise that we have. So we'll have a think about, well, what can we do without necessarily being experts ourselves? So setting the scene. I'm very purposefully today talking about physical activity. When you start looking into some of the research, some of the evidence, you'll notice the term exercise oncology. And there are certain areas of the science where people get quite specific about the terminology and talking about the specifics of exercise prescription and doses. And yes, that is really important as we're starting to understand how dose prescriptions can influence cancer and disease progression. But for the purposes of today, and being mindful that we are not all experts in this field, and that for many of the men that come through our clinic doors and sit in front of us, these are perhaps men who are fairly sedentary, who have perhaps not exercised for a long time, who have several comorbidities, who have just perhaps found out they've also got prostate cancer. And it seems possibly not helpful to start talking about exercise and perhaps even the term sort of sport. So if you drop in the term lycra, you might not get much of a conversation back. So I'm purposefully talking about physical activity in its broader sense. The definition of physical activity is any bodily movement caused by a skeletal muscle contraction with an energy expenditure. And so it really covers anything from a sort of an active lifestyle change. So perhaps trying to be less sedentary, trying to move around more, perhaps incorporating an active commute to work, or perhaps walking to the shop as opposed to getting in the car. Perhaps thinking about active hobbies. So perhaps a coffee with a friend could turn into and a short walk around the park with a takeaway coffee, as well as, of course, more active and organised sports. So it's impossible to talk about physical activity without referring to the physical activity guidelines. So please take this message home for yourselves, your family, your partners, etc., your work colleagues, as well as the patients that you support. This is the Department of Health guidelines based here in the UK. These were revised back in 2019. So they're really based on the latest evidence about what's the least amount of physical activity we have to do to get the most health benefits. And these guidelines are for adults and older adults. So this includes people with a cancer diagnosis. The recommended minimal amount of physical activity to maintain good health is 150 minutes of moderate intensity exercise per week, or 75 minutes of more vigorous intensity per week. And by moderate, we're meaning something which perhaps gets you a little bit warmer, perhaps starts feeling a little bit more breathless, but you could still just about hold a conversation with somebody who is alongside you. Now, alongside the cardiovascular element of the guidelines, it's also really important that we don't neglect this orange blob in the middle, which talks about building strength on at least 2 days per week. And we'll talk about this in more detail as we go through the presentation, particularly in relation to men who are on ADT therapies, for whom this is really, really important. There's also a blob there, that yellow blob, about minimizing sedentary time. We don't necessarily have the evidence yet to say how sedentary is too sedentary. Certainly when you have a session like this, a half-day session at a conference where it's virtual, perhaps you're sitting for long periods, please have my absolute permission to stand up and walk around the room whilst you're listening, because, you know, typically as healthcare professionals, we may well be guilty of sitting for long periods during a busy clinic or a lengthy MDT. So the message, and this is really sort of backed up by the evidence, is about every minute counts. Some is good and more is better. So we meet our patients where they're at. And if we're meeting somebody who's very sedentary, then let's remember that, you know, every minute does count. So any slight changes we can achieve by way of behavior change is really beneficial. And I think it's helpful to know that. So just to continue our scene setting, let's just think for a minute about our general population. And think about, well, how many people do we think are actually meeting those guidelines? So if you have a look at the graphic on the left-hand side, about a quarter of the population in England are currently physically inactive. So this is based on Sport England Active Lives Survey data from 2021 to 2022. Now, I look at this fairly frequently in various presentations and work, and it never ceases to shock me in a way that people can lead such a physically inactive lifestyle. And that's even with my job and with the sorts of patients I see. If we dive into that statistic a little bit more and we think, well, who is likely to make up that quarter of the population who are doing less than an average of 30 minutes per week? The other graphics around the screen sort of give you some of the answers in terms of who might be in that group. And I've particularly picked out some of the factors which influence the sort of patients we're likely to see sitting in front of us in a prostate cancer clinic. So we know age is a barrier to physical activity. When people age, the graph there shows that physical activity levels decrease quite significantly over time. So prostate cancer is a disease of older age. We know that men are typically likely to be in that older age categories and therefore likely to be less physically active. If we come down to the left, bottom left of the screen, we know that people with a disability are more likely to be physically inactive. So disability or long-term condition, and cancer is now classified as a long-term condition. We are, you know, successfully keeping people alive for longer, which is something to be really celebrated. But it's so important that we keep people living well. And the last one that I've chosen to highlight is really about ethnicity, because unfortunately there is an inequality here around ethnicity. And men with prostate cancer, we know that Black men are more likely to get a prostate cancer diagnosis. And unfortunately, Black men are also more likely to be physically inactive. So this graph just really highlights the green line for people who are able to maintain that 2 sessions of strength and balance exercise over the course of the week versus people who are on the blue line, who've sort of some point in sort of childhood, perhaps as they hit teenage years, fall onto that blue curve. And as the years go on, as they go through adulthood and they progress into older life, they are less and less likely to stay well, and they fall into that disability threshold much earlier. Now you'll see that box along the bottom where it says diagnosis of disease or significant disease event or hospitalization, aka let's say that's somebody who's been told they've got prostate cancer. This is a significant life course event where passively we've got the opportunity to influence behavior around physical activity. Unfortunately, the reality at the moment is it's likely to be a reason why people fall into that disability threshold much earlier than they need to. So in terms of linking some of this to cancer, from a direct cause perspective, very few cases of cancer can we say are directly attributed to physical inactivity. You can see physical inactivity there as a modifiable health behaviour falls fairly long way after smoking tobacco and a poor diet as a cause of death in the UK. But it is up there in terms of number 3 risk factor. So it does deserve our attention and our time, because not only because being physically active, there's a link there between diet and smoking behaviour. If we think bit more specifically about prostate cancer, we know from a couple of studies, the one that's quoted here is from an Australian study where they asked over 600 men who diagnosed with prostate cancer about their exercise behaviours, and they found only 12% of men with prostate cancer exercised to the recommended levels for good health, so to the levels of the equivalent Australian guidelines. So I hope in those sort of introductory few slides, I've made the case that at the point of diagnosis, so for any of us who are seeing men at that beginning point in the pathway, men with prostate cancer are likely to be insufficiently active to maintain good health. Unfortunately, the evidence also tells us that when we give somebody a prostate cancer or any cancer diagnosis, their physical activity levels tend to drop further. Now, there's many reasons for that. It's a sort of a multifactorial picture. So it might be that people are immediately very fearful about perhaps things that they've always done. People often come into our clinics and say, well, I used to do that, but I stopped as soon as I got told I had cancer. And there's no real reason that they can explain as to why, but they just did. They just suddenly weren't sure that that was the right thing they should continue to be doing. So there is a health education part to this as well. We also know that, people go from having, life that's theirs to decide what they do with, to suddenly being filled up with appointments, with scans, with treatments, and people's free time and leisure time gets significantly impacted on. And not least the cost of taking part in perhaps some of the less affordable physical activity and exercise and sport type activities such as gym memberships, etc., may well become difficult if people are financially challenged following a period of ill health. So let's just add a bit of insult to injury on top of all that. We know, that we're likely to have a fairly physically inactive population in front of us. And then what do we do? Well, unfortunately, without pointing any fingers, because I fully understand the sort of the busyness of clinic and the competing priorities of information to share, but we know that one of the reasons why people aren't physically active is because they're not told about the importance of being physically active. And this was taken from an international expert advisory group who worked with the American College of Sport and Exercise Medicine, who are really sort of the gurus that a lot of us look to in terms of understanding what the latest evidence says around being active. And they found that there was a lack of clarity on the part of those who work in oncology clinical settings of their role. So people not necessarily seeing it as something that they need to do. And I hope that as we go through the presentation, regardless of your role, I'll perhaps sort of gently challenge that, and we might see, well, how can we incorporate physical activity promotion into our routine clinical care? So this is the sort of the additional insult to injury bit. This slide probably needs no explaining for those of you who work routinely with people with prostate cancer. The first 4 of those treatment types account for most of those sort of toxicities, those side effects, those reasons why it becomes physically and psychologically difficult for men to participate in physical activity. So you might have somebody who's, perhaps for whatever reason, not being physically active. We then unfortunately tell them they've got prostate cancer. We then give them a treatment, and we know there are toxicities related to that treatment which are going to impact on their ability to keep active. So chances are their physical activity decline continues unless we do something about it. So my second sort of key point really is that during treatment, men face side effects which are likely to have a negative impact on their ability to be active. Now, I appreciate I keep saying are likely to. There are, of course, some people who buck the trend. I'm sure we've all got examples in our clinical portfolio for whom, people who are very invested, very committed to physical activity, and they're desperate to keep going, and they defy the odds and achieve incredible things despite their diagnosis of prostate cancer. And we can learn a lot from them. But I would certainly, in my clinical experience, that is not the norm. So what does the evidence say? Can we be confident that we have sufficient evidence, sufficient quality and strength of evidence to promote physical activity, and perhaps to argue that it really should be our routine and our standard of care? Talking about guidelines, first of all, so these relate to two NICE guidelines in the first instance, which advise that pelvic floor interventions to address urinary incontinence and endorse rehabilitation to support health promotion through exercise interventions should be best practice. And another NICE guideline, which recommends weight-bearing resistant and aerobic exercise training, is provided for individuals on androgen deprivation treatment. And a category B guideline endorsing rehabilitation referrals for men who are starting on anti-androgen therapies. Unfortunately, we know that that is not often the case. This was taken from a paper which was looking at these guidelines and looking at referrals into rehabilitation services. And although we know there's such a high functional morbidity burden with cancer treatments, and this is speaking generally and not just for prostate cancer, we know only 2 to 9% of individuals are actually referred on to appropriate rehabilitation services, which is a real shame, and doesn't necessarily speak for lack of awareness of the need. It may well be, to a greater or lesser degree, the fact that those rehabilitation services possibly don't exist. So there's a slide here which just sort of summarizes the evidence in a more general setting, so not just with prostate cancer, but looking at the strength of the evidence really and some of the common side effects for cancer more generally. So we have strong evidence to say that generally being physically active can reduce cancer-related fatigue, can improve health-related quality of life, improves physical function, reduces anxiety, reduces depression, and reduces the risk of lymphedema. And if you go on to look through that slide, you can see it tells you, is that just aerobic, is that just resistance, or is that a combination of aerobic and resistance exercise? So that's a bit of a scene setter really, but let's dive into some of the prostate cancer specific exercise in more detail. So first of all, physical activity and prostatectomy. This is possibly where in many of our pathways people might get a little bit of support around exercise if we're talking specifically about pelvic floor rehabilitation. We know from a lot of the evidence that's out there, this is taken from work done by Joe Milios out in Australia. The men who complete pelvic floor exercises are more likely to see a faster improvement in regaining urinary control. And we know that it's helpful to start sooner. So if you can start preoperatively, so much the better. Now, quick moment aside as we just take an active break. I'm not going to get you jogging up and down the stairs or doing burpees. We're going to just do a quick run through of pelvic floor exercises and how to teach them, just to refresh our memories and also to get you doing something active. So always starting in a good position. I'm presuming in clinic, most of us are going to have a patient sitting in front of us. So encourage them to have both feet firmly on the floor, to be sitting up tall, nice and relaxed. So reducing any tension in the shoulder, in the jaw, trying to keep everything else nice and relaxed. It can be really helpful to have a model of the pelvic floor. That might be just a diagram, but if you have a 3D model, so much the better, because it really helps to educate that patient about this is a bowl-shaped structure made up of several different muscle fibers. And when we're thinking about pelvic floor contraction, we know from the evidence that it helps to work from the back passage. So perhaps the cue might be around stopping passing wind, and then bringing that sensation of a squeeze and a lift round to the front as if you're stopping yourself from passing urine. Now, cues can be really helpful when we're trying to activate pelvic floor muscles because it can often feel a little bit hard to instruct. So thinking about nuts to guts is an Australian cue that's used, or perhaps some visualization about imagine you're walking into a cold sea and you're squeezing and lifting down below. But essentially, that is the action that you want somebody to be mindful of. If somebody's really struggling, you might want to get them to pop their hand on their belly in between their pubic bone and their belly button. And just think about taking a breath in, feeling their tummy rise. And then as they breathe out, you're thinking about doing a squeeze and a lift, drawing up from in between your legs as if you're stopping yourself from passing urine. Now, we need to remember that there's two types of muscle fibers in our pelvic floor, the slow and the fast. So really important that we work the pelvic floor in two ways, with our slow, hold, contract, and then relax, and our quick squeeze and relax, squeeze and relax, with the rest period being equally as important as the hold period. So if you're working towards a 10-second hold for your slow exercises, once you've done that, you then relax and for at least 10 seconds or the same amount of time. For Patients, especially post-surgery, it's very unlikely they're going to be able to manage that 10-second hold. So meet them where they're at. If they can hold a good contraction for 3 seconds without everything tensing up, then that's where you start and you build from there. I hope you were doing them as I was talking. That was your active break. Moving on to some of the other treatments which we might throw at people: physical activity and radiotherapy. So we know from studies that one of the reference there was Horgan and et al. In 2018, that we have some really good evidence to say that actually being physically active during radiotherapy treatment helps to reduce the risk of fatigue. The results that are shown on the screen here is from Schumacher and colleagues in 2021, and shows that actually we've got some really robust evidence to say that also it can help to increase cardiovascular fitness, to increase muscle mass, and to reduce urinary toxicities and improve urinary control. So really, really helpful to know that as men go through radiotherapy, we have the opportunity to see men on several occasions. So real opportunity to educate and to support men, and also perhaps just to notice if people are starting to reduce the amount of physical activity they're doing. Thinking now about ADT, or androgen deprivation therapy. The risks of ADT, in fact, I'd sort of go a bit stronger to say, rather than just the risks, that the impact of ADT on reducing muscle mass, on impacting negatively on bone health, on increasing the likelihood of cardiovascular and metabolic disease, means that really I think we have quite a strong obligation to be supporting men to address those risk factors. And this paper here is one of a few which really sort of presents on the impact that being physically active can do. I think it's really important to note here that when we're talking about men on hormone therapy, whilst yes, we're sharing those physical activity guidelines, which I started the presentation with, we're really honing in on the importance of strength training for these men, because we know of the impact of ADT on reducing muscle mass. So it's really important that we are educating men about the importance of doing strength training whilst they're on ADT therapy. We also know from a bone health point of view, they need to be loading through their joints. So they need to be doing weight-bearing exercise. And as we get into more of the technicalities, we know they need to be doing more loading exercise, such as hopping and jumping. It might not be appropriate for everybody, but this is where we start to have a bit more sophistication around our exercise prescription. From a general point of view, though, the message is making sure men are, as much as they can, working towards those guidelines, but specifically thinking about the strength training with this population. Now, moving on to active surveillance. This is a group I get really excited about, because you may well have heard of this concept of prehabilitation. This is where we try and optimize people at a cancer diagnosis perspective so that they can tolerate treatment much more easily. We often get caught up in the fact that we don't have very long before they might have a major operation or start systemic anti-cancer treatment. But perhaps with active surveillance, we've got a real window here where we have men who are essentially waiting, although that's obviously not how we like to present it to them, but they have this period of time where they can really be receiving that education and being supported to do something positive for themselves. There are trials going on at the moment looking at actually, does that have an impact from a psychological point of view in terms of helping them feel like they're coping with their cancer diagnosis and overcoming perhaps some of the psychological challenges around not having a kind of an obvious form of treatment? Does that help them remain on an active surveillance pathway for longer? But the ARRAISE trial gives us some harder evidence perhaps around the impact of exercise on PSA levels, on PSA velocity, and prostate cancer cell growth. So that looked at 52 men, so half and half, 26 in each group, from a control group to a high intensity cardiovascular supervised 12-week training program where men were exercising 3 times a week. And the exercise group had decreased PSA levels, decreased PSA velocity, and reduced prostate cancer cell growth. So we're starting to understand that actually we possibly, with the right exercise dose prescription, have the opportunity to support men, not just to feel well, to feel looked after, to feel like they're doing something positive for their own well-being, but actually potentially to physiologically keep them on an active surveillance pathway for longer, which is really exciting. So key points. So the evidence strongly endorses that people with cancer are active to the level of the physical activity guidelines. In addition, there is good evidence now to support exercise as a means to reduce and improve some of the common side effects of treatment for prostate cancer. And those are working in the field of exercise oncology are now starting to look at, well, what's the specific dose prescription should we be trying to get men to work towards to have the maximum benefits for their prostate cancer. So opportunities for change. Well, this is just really for your background knowledge as you're starting to have these conversations with patients. What are the self-reported exercise barriers? This was taken from a Canadian paper with men who had received the education around physical activity. They knew it was important. And this is what they reported back in terms of this is what makes it more difficult. And this is what perhaps facilitates a more physically active lifestyle. So helpful to know as we frame some of these conversations and we can support men to achieve their individual goals. I want to just share this because I think it's hugely significant and empowering in this line of work, that the greatest gains are in those who go from doing nothing to doing something. So men who are sitting in front of you, who are very sedentary, who perhaps have existing cardiovascular disease, who perhaps are riddled with arthritis, who are really doing very little, and now we're telling them they've got prostate cancer. Actually, if we can support them to be doing that little bit more, working towards the guidelines, they have the most to gain by way of health benefits. So really perhaps helpful to have that in your back pocket when it's feeling like a difficult conversation to have. I would really advocate a make every contact count approach. I always sort of contrast two scenarios. One where people pass through their prostate cancer pathway, seeing a number of different people as they go through scans and treatment and investigations, and nobody ever mentions physical activity. And we contrast that with a pathway where at every key point, people just have a conversation. They just bring it up. They just say, how are your activity levels? Are you still able to keep being active? Have you noticed any problems with your walking? Are you still going to your bowls? Do you want any information or support? The perceived importance in somebody's mind is going to be far higher with that latter scenario. So there's some information on the screen that sort of backs that up from the study that was done. And I would wholeheartedly recommend the Moving Medicine website, where you can click in cancer and you can find some really helpful resources to support your own clinical practice. And when we're having these conversations, we're trying to find a hook that is meaningful for the patient in front of us. And that might not be something medically related. So that might not be motivating for somebody to know that they can reduce their side effects, especially before those side effects have happened. It might feel far too abstract. Sometimes it's around you'll still be able to play with the grandchildren, or somebody might still want to go to work, or they might have got their heart set on a Caribbean cruise. It might be these things, and it's actually how can we help you to enjoy that experience, to keep doing that, and physical activity plays a key part in that. And that might be the hook to have the conversation. It might not be around, oh, did you know that this is going to reduce your cancer-related fatigue, especially before that's become a reality for that individual. So thinking about physical activity and the benefits of it in the widest sense that we can. There's perhaps a helpful consensus statement here, which again is on the Moving Medicine website, and it was produced by a group of experts who looked at the evidence around risk versus benefits. And the overwhelming conclusion really was that the benefits outweigh the risks. And I think that's reassuring for those of us in clinical practice for whom perhaps this isn't our expertise, to know that we are generally safe to be advising people to be physically active, even with the long-term conditions they might present with. However, whilst the risk might be low, that's not necessarily how people feel. And so people do need that validation, that reassurance from us, and the opportunity to ask questions or to ask for support to enable them to maintain a physical activity lifestyle, or perhaps, have their cancer diagnosis perhaps be that prompt, that motivation, that moment in time where perhaps they reflect on past behaviours and choose to do things which might benefit their health going forward. As I said at the beginning, I'm well aware that we're not all linked into all singing, all dancing exercise support services. In fact, I'm probably sure that there aren't many of those around. I hope that's something that will change as this evidence builds and as we get the word out there and as we educate not only our workforce, but also our commissioners and our funders. But in the meantime, there are some services out there which can be used universally for men with prostate cancer, for their carers as well. And I've just put a selection of them on the screen that you might want to sort of have a little Google or search for later, and perhaps just, have a couple of those in your back pocket, just maybe laminate some of these and be able to share them with patients or display them in waiting rooms, have them readily available, so that when people say, yeah, I'd like to do a bit more, you've got some options up your sleeve. So I'm going to finish with some myth busting frequently asked questions. I had the absolute privilege of being one of Prostate Cancer UK's clinical champions, which allowed me to work with multidisciplinary colleagues across the country. And they very generously shared with me the questions they would like to know the answer to. And I thought I'd share some of them with you today in case they are also of interest to you. So I was asked, does exercise compromise ADT effectiveness? We can say confidently with the evidence that we have at the moment, which measure testosterone levels alongside exercise interventions, there was no increase in testosterone and no negative outcomes from a cancer management perspective. So that's really reassuring. When can I ride a bike after a prostatectomy is something we often get asked. That's going to vary, and it's really down to comfort level. We recommend waiting between 2 to 3 weeks and then, having a sit and see how it feels, perhaps waiting a bit longer if it's still uncomfortable, maybe considering a padded seat for a period of time, and just bearing in mind that internal soft tissue, which we can't really see, takes about 6 weeks. So in terms of the stress of an uphill or a multi-gradient ride, you might want to wait for that time frame. Question 3, should men with bone metastases still be encouraged to exercise? Absolutely yes, especially if they're active already. If they're asymptomatic and their disease is stable, then absolutely encourage them to continue doing what they're doing, possibly avoiding high impact or contact sports. So if that's their preference, that might need a more specialized conversation. But I would have a low threshold for finding some specialist advice for them, because certainly in our practice, we would ask them some quite specific questions. We would look at the scan to see where their bone disease is, to see what type of bone disease it is, to see how much it impacts on the joints, and to see, sort of match that with the individual's goals and what they would like to do. So it's not an easy one to answer in a one-liner, but we do know that it's really important we don't neglect people with advanced prostate cancer. And actually, they've got huge benefits to be gained from being physically active. I'm doing my pelvic floor exercise easily, but not improving. Help. I hope our little run through there perhaps gave you some ideas as to perhaps how you might change your own teaching and instructions of pelvic floor exercises if this is a question you come across yourselves. It is always worth checking technique and just rerunning through the basics. They might need progressing. They might have plateaued and they actually need to be challenged a little bit more. So rather than just sitting in a chair, you might need to take it up to standing. You might want to do it in a stride stance. You might want to do it whilst doing something else to challenge the pelvic floor that bit more. Conversely, you might actually need to drop it down a level. So if they're getting nowhere in sitting, you might want to take it down to a lying position with the knees bent and just see if that helps to initiate a contraction a little bit more. Failing that, then they really do need a referral to a pelvic health physiotherapy or therapist or another specialist who can assess them in a more in-depth way. How do you advise someone to exercise with cancer-related fatigue? It's such a common side effect. Up to 90% of people report cancer-related fatigue. And it's helpful for us to legitimize that actually, if you're feeling really fatigued, it's hard to be physically active. A good sort of starting point is to ask someone to keep an activity diary first, because it can be really tempting to, when they're feeling good, to do a lot, and then when they're having a really tired day, to do nothing at all. And so they come into this kind of boom and bust cycle, and gradually over time they're doing less and less. So keeping a diary so they can monitor their activity levels can give you some insight into what their behavior is, and perhaps some tips that they can use to address that. But they certainly want to be including cardiovascular and strength training in any exercise program. And where should men start with strength training whilst on ADT? It's relatively straightforward to advise somebody about cardio. You can talk about going for a walk if they're new to exercise, but it's more challenging to think about strength training unless you have a sideline as a personal trainer. So there's a reference on there to Stronger My Way, which is a really nice resource by our Chartered Society of Physiotherapy, where patients can get an idea of what a beginner level body weight resistance program might be without any need for any specialist equipment. So people can have a really effective strength training program without the need for any equipment or specialist support. So that might be a helpful signpost for people not knowing where to begin. And finally, my sort of final thoughts to leave you with, really, I hope that's been of interest. And I hope I've got across the fact that some exercise is better than no exercise. So it's reassuring for us to know that, but also it's a really reassuring message for us to pass on to our patients, especially those who are feeling really challenged by some of the side effects of the treatment. Exercise is safe and it is effective. So recent evidence shows that exercise doesn't interfere with cancer treatment or responses to cancer treatment. And actually, possibly as the evidence starts to build, we might be able to say with more confidence that actually it has a really important part to play in helping to manage cancer going forward. You don't need to be an expert. So healthcare professionals have so many opportunities, so many touch points with patients where we can reinforce positive messages around physical activity. So simply asking the question can be really, really useful. And a good sort of a line to have in your head is be as active as you feel you can be. Some is good, more is better. I'll leave you with the references. Thank you so much for listening. And I'm more than happy for anyone to contact me at any time for further questions or more information.